Good afternoon, everybody. And my name is Nigel Herbert of Medallia. I hope everybody can see me and hear me okay. Thank you all for joining this webinar on what is a particularly grey day here. So I hope we can put a bit of colour into your day by discussing the most vital and colourful part of healthcare, our patients, and how to leverage the insights they provide for us to optimise healthcare delivery. Patient journeys are being revolutionized thanks to interactive technology, which puts consumers or patients at the heart of their own care. Today, we are going to hear how international experts are leveraging technology to gain fresh insight into the patient experience. Traditionally, healthcare data has centered around clinicians and institutions who have largely controlled patient interaction. Lately, however, there's been a shift to consumer-centric systems, a core component of value-based healthcare. And this is enabling patients to interact with health professionals and get more involved in their own care, leading to greater engagement, improved outcomes, and increased satisfaction. So I'm just going to start my sharing my screen. Okay, hopefully you can all see my screen. So as Medallia's Industry Director for Government and Healthcare, it's a great privilege to be leading this webinar today. Joining me, we have Joe Thompson of KPMG and Michael Dubno of LuxMed. Joe comes from a consulting background and has had an illustrious career in customer advocacy and culture change. She joined KPMG from the Bank of Ireland, where she was previously responsible for group culture and engagement. Michał is the customer experience executive at LuxMed in Poland. He joined LuxMed in 2018, following some 10 years in consulting at Bain & Company, Deloitte, and then the Boston Consulting Group. As we go through this webinar, please do feel free to put your questions in the questions online, and we will review them following the presentations. I'm going to hand you over to Joe in a few moments, and who will share with us a point of view and some thought leadership around how we can make better use of customer experience in the context of patient insight and staff experience as enablers for transformation across the NHS system. Following that, Michael is going to walk us through how LuxMed in Poland have succeeded in putting the patient at the heart of their healthcare system, of what is the largest health system in Poland. I will then conclude with Medallia's point of view for healthcare and how our solutions can help unlock the value of patient and employee insights. Before I hand the baton to Joe, I want to share a short 3-minute video with you, which will really help put all this into context. As they say, a picture paints 1,000 words. The video was produced by the US Department of Veterans Affairs, the largest hospital system in the US, who, having reached a point in 2014 of being the least trusted public service organization in the USA, realized they needed to do something radical to transform and make a difference. They embarked upon a human-centered design approach, working with Medallia to understand the experience of their patients, the military veterans, right across the patient journey. The program, which was born out of this, known as the V-Signals program, has subsequently raised the bar dramatically for them. Trust has increased from a low of 55% to an all-time high of over 80%, and has led to over $780 million in savings. More importantly, by listening to their veterans and acting upon the insight which the Medallia platform has surfaced for them, there is evidence they have saved over 3,000 veterans' lives from risk of suicide. The V-Signals program has allowed them to understand not just the solicited feedback from patients, but also the unspoken, the unsaid, the why behind the what patients are reporting with. I'll play the video now. There is no sound, only background music during the video, so don't worry too much if you don't receive the sound clearly at your end. So just bear with me a second and I'll share my screen again. So I hope everyone's able to see the video clearly. A very powerful, sometimes emotional storyline, which demonstrates how critical it is to understand what is going on in the background of a patient's life, often the unsaid, if we are truly to transform and drive the business of providing healthcare to a point where the patient really is at the center of all we do. Joe, I'd like to hand over to you now, please. I'll start the screen share again, and over to you.
Thanks, Nigel. That video gets me every time. I've seen it a number of times now, and I still get quite emotional. So lovely to meet everybody. I can't see you, so I'm talking at a set of slides, and I can see Nigel and Michal, and that's it. So very nice to meet you virtually. My name's Jo Thompson. As Nigel said, I'm a director in our customer team in the infrastructure, government and healthcare part of our consulting business at KPMG. And my time is generally spent in healthcare and local government. I specifically focus on customer transformation programs and also spend quite a bit of time looking at how to bring customer or patient into the design of what's upcoming in terms of care system design. And it definitely is one of the reasons why I get out of bed in the morning, being able to take my skill set of 30 years and put it into these areas at the moment. We enjoy a relationship with Medallia because it's very important to us that we bring insight into design, and we also have a sustainable solution for how we measure patient experience or customer experience on an ongoing basis. So I just have a few slides for you today. As Nigel said, my role today is to share a point of view. It's definitely not the only view or the right view, but it's just a point of view on some things that we are seeing at KPMG that are important in the space of staff and patient experience. If it's okay with you, and I know you can't talk back at me at the moment, but if it's okay with you, I'm actually going to use the word customer because some research that we did recently actually pointed out that more than 3/4 of people, when asked, and I mean citizens, when asked, actually say they see themselves as customers, they don't see themselves as patients. And we thought that was really interesting insight, and I'm going to come back to some more little sound bites like that later on. So if it's okay with everybody today, I'm going to use the word customer. I know that's contentious, but that's what it is. So what you see on this slide here is that our belief, and I hope you can see it because on my slide I've got, yeah, brilliant. It's our belief that, you know, if one of the objectives of this session is to focus very much around measurement of patient feedback and insight, then you'll see that that's one very important component of a really great customer transformation strategy. But it's not the only thing. And our belief is that you've got to get all of these things on the wheel working effectively for you when you're thinking about being truly customer centric. That starts with your purpose and values. So how clear are you around your ambition and your vision for what it is that you want to achieve through the lens of your staff and your customers? And secondly, how joined up all the leaders in the organization that you work in are aligned to that purpose and vision. Often what we find with customer strategy is that people never get out of bed in the morning to do a bad job for their patients or their customers, and they therefore believe that it's inherent within them to take their own personal strategies. However, for transformation to be sustainable and for really a good customer-centric culture to exist, it's really important that leaders are joined up on what good looks like. And the other things around the wheel are equally as important. I'm not going to go into them today, but I wanted to focus on those three things around, you know, making sure that you've got the right treatment and the right channel, and making sure that you're delivering the right service in the right place at the right time, which is particularly important for care system design. But at the same time, being very cognizant that we've got to be inclusive in the way that we do that so that everybody has equal and fair accessibility. And then and only then, once you've designed all of that and you're really clear on that, should you think about what kind of technology is required to make all of that happen. So that's a kind of overarching umbrella that we use regularly in sort of high level points of view. I just want to go to the next slide, which starts to talk a little bit more about some global views. So at KPMG this year, globally, we conducted some research across 200 healthcare chief execs. And the essence of the report was broken down into about 5 or 6 chapter headings. Very happy to send you the link afterwards. What I've got on this slide is the specific patient-centric view of those chief execs, and just some sound bites for us to consider today around the fact that customer expectations are rising. The evidence suggests in a number of surveys that we've researched pieces that we've done that there's a very thin divide now between what we expect in the private sector as opposed to what we get in the public sector. And you'll see there the stat that says it's about, from a chief exec's perspective, 67% believe that they have the same expectation around service, quality and accessibility. Equally, the chief execs that we were interviewing said that, you know, there is really good progress that's being made. So a lot of central government departments making great progress with better and speedier technological innovations, particularly post-pandemic. However, they're also saying there's a long way to go in achieving excellence. And the two that we've highlighted in this report talk to accessibility and digital enablement, and that's no surprise for anybody on this call. Some of the trends that we pulled out of this piece of work were around the stat there that there's a huge acceptance that patient centricity needs improvement. However, significantly less chief execs actually have that embedded into their strategy, and even less, only 18%, are actually doing something about it, which is quite interesting. And finally, just that last kind of soundbite at the bottom of the slide, what our chief execs that we interviewed said that to be truly patient-centric, there's quite a bit that we need to do around getting higher in the areas of meeting needs, quality of communication and quality of outcome. And the essence of that feedback was very much around designing from the outside in rather than the inside out. So that's sort of point of view and a global perspective, but I just want to bring it down to the UK. So we just go to the next slide, Nigel. At KPMG, some of you may have heard of this. We run a think tank that's called the Customer Experience Excellence Centre. It's an international think tank. It's been going for 11 years and up. And essentially what it does is it pulls out 6 pillars that we benchmark brands against on an annual basis. And over time, we've developed enough essentially sound bites and verbatims and feedback from customers that the 6 things on the right-hand side of the slide are the things that really matter most to customers when they're experiencing service delivery. And they are personalization, integrity, managing expectations, resolution, time and effort, and empathy. Over the years, we've been able to benchmark what really great looks like against each of those 6 pillars. And this year, for the first time, both in the NHS and in local government, were included in this report and in the research that we conducted. And you'll see there at the bottom right-hand side of the slide, we managed to get a pretty comprehensive view from a number of citizens across the UK in both health and local gov around their feelings and their sentiment towards each of these 6 pillars. The research doesn't actually launch till next week. So for the 36 people that are on this call, you're going to get a sneak preview of it. But please don't tell anybody because I'll get into trouble. And the research is on the next slide. So let's have a look at it, Nigel. So essentially what we found, or what the citizens that we interviewed fed back to us, was that some of the more higher scoring pillars were around integrity, empathy, and managing expectations. And you'll see there on the right-hand side some of the specific sound bites that we've pulled out of reasons why. Now, I think the majority of us would probably agree that given the pandemic, the level of integrity and support, particularly for the NHS, is profound. And that's perhaps why citizens were scoring that more favorably, and that makes perfect sense, and a huge amount of acknowledgement from citizens that it's been one of our saviors over the last 18 to 20 months. But what they've specifically pulled out in terms of areas for improvement are things around resolution, time and effort, and personalization. And specifically, if you look at the right-hand side from a resolution point of view, it's around just not dealing quickly and effectively with issues and concerns. Staff with the inability to go the extra mile, that doesn't mean they're doing a bad job for the patient. It just means that they're limited or constrained in being able to go the extra mile, particularly if you think about care system design and that end-to-end view. And then building on that from a personalization perspective, looking at citizens saying that they don't feel recognized, they're having to start again and repeat stuff over and over again, and their previous interactions aren't being taken into account. And then finally, from a time and effort perspective, citizens saying, they just couldn't get through to the right person at the right time on the first attempt, and having to keep trying until they got through to the right service deliverer. And finally, focusing on accessibility, not easy access to services, whether that be channel or answer, were some of the key findings. So they may not be rocket science, and I'm sure we'll all agree that they sound pretty sensible. But what we thought was helpful with this research is that you can't do everything, particularly in today's society, and being able to just segment a little bit and break it down into the 6 pillars certainly helps health professionals focus on where to start and what matters most. And I'm sure that Nigel and Michal will come back to that in terms of the insight experiences that they have. So I just wanted to conclude on the last slide, which is a lot of people say to us when they see research like that, oh my goodness, well, where do I start? What do I do about all of that? And this is a bit of a wheel that we use to help people understand that, if you're really going to become more customer centric and focus on a customer service strategy, then there are kind of 8 things that are really important. And they are, who do you engage with? What are you providing to them? And how are you going to do that? How are you going to make that transformation happen? Again, none of that's rocket science, but we like the simplicity of this because you don't need to overcomplicate it. It's a case of really getting under the skin of who your customer populations are through decent insight and segmentation and customer and particularly staff personas. It's about being joined up on that vision so that you can use that to drive future decision making. It's about making sure that you're really clear on the services that you want to offer and provide, but they're joined up and that they're end to end rather than being delivered in silo. And then and only then do you look at the specific capabilities required to make that happen, whether that be digital, whether that be skill, whether that be new governance or finance, whatever it may be. And then think about what channels you need to support that. And essentially surrounding all of this, and culture should essentially exist around all of these, is how do you pull all of that together? Where I started on purpose and values and leadership, that to make all of this truly customer centric and to raise the scores from citizens, the fundamental ingredient for success is how your leaders come together on identity, on culture and purpose, what you stand for and how you work together across the continuum. So I trust that's my allocated time, Nigel. Over to Michal, I think.
So thank you, Joe. That was for that very enlightening thought leadership around driving customer excellence and the value of it. And if we are able to mobilize our organizations to take account of it and act upon it in a timely basis. So that was very, very enlightening. So thank you. Michal, over to you, if I can.
Thanks, Joe. Thanks, Nigel. So I would start from a little bit describing like who we are. I'm from Poland. I work for LuxMed. We are the largest private healthcare provider in Poland. What does it mean? It's 2.2 million patients. It's 200 outpatient clinics, 5,000 physicians, 4,000 nurses, 12 hospitals. So As you can see, it's a massive operations, and we're a little bit different than usual markets. We don't sell insurance. We are more kind of subscription business, kind of Netflix of healthcare, but quite successful in terms of convincing patients to use our services, 2.2 million. And 4 years ago, LuxMed decided that it needs huge change in terms of focusing on the patient, focusing on the customers, really making sure that we deliver best to our patients, not only from the medical point of view, but we also believe that high quality of medical services is a great part of our business. So we're trying to position ourselves in much higher quality and really serving our patients the best way we could. And so we started building a program. We have, if I can ask for the next slide, Nigel. We started building the program that we developed around 14 micro moments. At that point, we needed a partner that would help us to support from the architecture side, and to give us the solutions that we could use to really run this program. We're starting from few micro moments. Now we have 14 of them, and we're still expanding. But getting the feedback from our patients in those 14 micro moments wasn't easy part, but it's only a beginning, because we're doing some elements in medical center. We're doing some part in our digital services, from online booking to patient portals, external services, external clinics, refunds, home visits, all that. We needed to send some invite to our patients, tell us what we think, how we are doing. But it was just the beginning. Like listening the voice of the patients is just the start. Can I ask for the next slide? So next thing, which is extremely important, is to have the group of people that are really focused on this voice. So it's also great functionality of Medallia that we were able to give this voice of our patients to our clinics, to our high but also mid-level management, and involve them in really talking to patients. So at that moment, we have around 800 people at LuxMed who are using Medallia tools to improve customer experience. So they are calling to those patients every day, asking, okay, you submit the survey, you were complaining about some elements, we would like to know some more details. The software is supporting us in really driving the change. In many organizations, we see that there is a small group doing the research and nobody knows what they are doing. In LuxMed, supported by Medallia, we want everyone in the organization to really be responsible for that and really manage the customer experience. But then having all the people creating this culture is also another step, but it's not enough. Next slide, please. So then what we needed for that is to make an action. This voice of our patients needed to be transformed into some initiatives. Some of the elements our clinic managers could do ourselves. If someone is complaining, like, I don't know, is not clean enough in the medical center, so clinic manager can do some actions to improve that. But a lot of these elements are related to the processes that are developed for the whole group, and they require changes in the systems, they require changes in the processes. So only last year, out of that, we have run almost 220 customer experience initiatives. There were inside 65 larger projects that we were running to change what our patients requested. And we were working and focusing on 92 pain points, trying to remove them or decrease this pain at least a little bit. So with the support of Medallia, we managed to create the whole culture, starting from listening the voice of the customers, spreading this voice around the whole organization, then moving to really actions and changing the way we are operating. Did it bring the result? Yes. Can I ask for the next slide? After almost a year of working, we've noticed that NPS of our patients started growing. And now when we compare to where we were in the beginning of 2018, in the last 3 years, we improved this by 44 percentage points. So it's a huge change. And it's very good for us, and we are extremely happy that we see that this voice of our patients is changing, that they really see and appreciate the changes that we are implementing. But we can continue, because it's also extremely important to our top executive, to our board, because as you can see on the next slide, following this change in the NPS also improved the key KPIs that we put for this program. So the increase in the average revenue per user. It was flat for many years at LuxMed, and we were wishing to improve that by increasing the quality of service. We were willing to be able to increase the prices, to convince our patients to use more of our services. And starting from this moment of changing the culture of LuxMed towards organization being patient-centered, we managed to improve this average revenue per user by 6% only from Q4 2018 to Q3 2019. So what I want to say is that if you want to run really a program that is willing to change the organization, really change the way the company behaves and how it treats its customers, its patients, first of all, you need to design it pretty well to involve and change the culture, but then you need to have a partner like Medallia that will help you to really support that. For us, it's almost 500,000 of surveys per year. So reading all those comments, having text analytics tools, all that kind of elements, supporting that feedback loop, and making it easy accessible for 800 people. This is why you need some good tools for that. So that's all from my side, and I'll hand over to you, Nigel. Thank you.
Thank you, Miguel, and nice to see some of the benefits of it in operation. So, a fascinating report around the progress of patient experience at LuxMed. So, lastly, I want to share quickly a point of view on patient experience and how we accelerate the value to be derived from patient insights for tremendous results with the Medallia Experience platform. So if we look at the start of this slide, it starts from the patient perspective with feeling heard. And this has traditionally been a big miss we've made in healthcare, in my view, often as a result of the fact that clinicians and institutions have largely controlled patient interaction. But when we really listen to patients, such as in the example we showed in the US veterans video, both the spoken and the unspoken, we start to understand our patients and meet them where they are, and they feel heard. Digital systems can now enable providers to see entire patient journeys, delivering real-time actionable insights. The patient journey, which is made up of many micro journeys, interconnected, if you like, but they can be broadened, and you can go deeper with the insight that you can surface. And by working in real time to resolve or repair those patient experiences and identify the friction points among patient cohorts, you can really make a difference. The legacy patient experience data and surveys that we typically use in the NHS, take for instance the friends and family test, they are really no longer fit for purpose. Similarly, our staff surveys tend to be out of date before they are even published, implying the ability to act on the valuable insight on a timely basis is unrealistic. There are lots of things you can do to create positive patient experiences, offering patients physical and virtual access to medical advice, along with primary and specialist care when necessary, with minimal waiting times, can all make a difference. Clinical quality and good outcomes are, of course, essential, as is easily accessible information. If you're looking at it from a from an employer's or an administrative point of view, the value and delivery of care has to take into account the caregivers too, because you need to provide the right kind of information so that healthcare practitioners delivering care are also effective and their time is optimized, so they are as efficient and productive as possible. Being in that state creates a positive experience, and they can pass that on to the patient. Efficient, well-informed staff are confident and happy. Happy staff equals happy patients. Of course, personalized medicine comes into the equation as well. We typically intend to invest heavily in the sickest patients. But how can you drive better value out of investing in the data of precision prevention? Let me get that right. The data of precision prevention in the well community, instead of only focusing on fixing patients when they come to us broken. Patient insights are the key to this paradigm. So there's a widely recognized need for engaging modern listening and engagement strategies, both to take account of what the patient is thinking and feeling, and to gather insights from the frontline staff within the organization. Technology offers a way to capture and analyze this experience data in one place, so that decision makers can immediately understand how to support staff and address their needs in the moment. Medallia's healthcare experience management solutions allow you to meet your staff and your patients on their preferred channels and collect and analyze experience signals from these interactions. We look at the top left-hand side of this chart. We capture with Medallia Experience Cloud every signal from across the patient journey: solicited feedback, unsolicited feedback, structured data, unstructured data, data from our existing systems, be that our electronic patient records or our outpatient booking systems or whatever. And then we cut through the noise of that huge amount of data using AI and machine learning to focus on the moments that matter. We use speech analytics to enhance and AI to enhance video solutions and read even facial expressions if we want to, to interpret emotion and provide actionable insights to decision makers. Then we put those insights, if we look at the right-hand side of the chart, in the hands of your staff from the boardroom to the front line, empowering your caregivers to take action in the moment. The ability of this rich information to guide and healthcare delivery and operational improvements and staff welfare initiatives is precisely what makes Experience a powerful early warning system and an enabler for transformation in our quest to drive elective care recovery. As we enter the new age of patient-centric care, we start to more widely recognize Experience as a fundamental element of care. The onus is on healthcare providers to capture, analyze, and act on the views and the ideas of what is sometimes the silent majority, both among their patients and their staff. Ensuring that the patient and all the participants in the care team feel heard creates more positive experiences, which not only optimize the care pathway, but also foster community, loyalty, and engagement, and above all, build trust. Only by moving past the strictly clinical aspects of care to a more holistic, experience-driven approach will the sector become as patient-centric as it rightfully deserves to be. And in so doing, it will deliver better healthcare experiences with extraordinary benefits to both the patient and the NHS system. So in the time we have left, we should look at the points which have been raised in the chat and open the call to questions. So if you haven't yet posted any questions you might have, please do so in the Q&A feature on the platform, and we'll try to come through them now as quickly as we can. So we've got 2 questions already in the chat, which we'll start with those. Joe and Mikhail, well, I'll look to you for your expert advice on an opinion on some of these from your experience. So the first one from Emily, interested to know if you ever engage health psychologists to apply psychological principles to interventions and health promotion. I'm a management consultant trained to qualify as a health psychologist. My experience so far is the profession is underused. Good question, Emily, and very pertinent, really, I think. Joe, would you like to take this one first, please? What are your thoughts?
I agree that it's probably underused. I wouldn't know how used health psychology is, or the application of psychology is in the healthcare industry. But I definitely agree that it's underused, and there's a huge potential if you look at the last 18 months around how we market and educate citizens on how to behave has become so important. It's gone off the scale. And if you take some of the advances and progress that we need to make in the next 2 years, particularly from an integrated care system perspective, you know, the need to change our behavior. All of our behavior in the UK is ingrained in how we behave. You know, you get ill, you go see a doctor, and the whole psychology of care system design is to push that left and focus on the individual citizen taking accountability on their own right, to research, to be much more in preventative mode. And, you know, some of the infrastructure that needs to go in place around speaking to your pharmacist or your dentist or someone in the community, or an ambassador if it's in a local government context, that's a huge, massive behaviour shift for every single person in the UK. And I don't think that from a health psychology perspective, we've really thought about that enough. So I'm basically agreeing with you, would be my shout.
Maybe I will add few words to that. I basically agree that it's definitely underused. We started using this a little bit, considering some of the problems that we are facing. One example is that, for example, at the moment in Poland this year, after 2 years of kids being closed, a lot of time out of school, not being in touch with the infections, at the moment when they are back in school 100%, we have the huge wave of the infections of the kids, and we are trying to deal a little bit with some pediatrician support, how to really deal with this huge demand. And one of the elements that we've noticed is that part of the work of the pediatrician is calming down the parent. It's not that the kid has huge problems and it needs medical attention. Half of the time, it's basically telling the parent that your kid is safe, nothing wrong is going on, and providing this information, calming down from psychological part, how to really discuss with the parent. It's important part of what we are doing now, trying to self-educate about is really what my kid is going through is dangerous or not, should I stay home, or I really need to attend the doctor. So making this psychological part of the cooperation between parents and the pediatrician is important part of our work. And this is just one example, but definitely I agree there is much more to think about and use this profession.
Thank you, Mikhail, and thank you, Joe. Yeah, and I think it's a very interesting question and a whole topic in its own right, really, which probably deserves its own webinar. But no, thank you for raising that, Emily. Hope that goes some way to addressing. A second question we've got is, what would you say is most important to take into account when incorporating patient and staff experience into digital transformation processes? I'll perhaps start off with a response to this, because my distinct impression from what I've seen so far in my work with both government and healthcare providers in the UK is that the single most important thing to take into account is not just about gaining the insight and the feedback and the signals from your constituent, whether that's a patient or a citizen or whoever. It's actually being able to act upon that insight. And that is, it's about closing the loop. Once you get that feedback, that insight, doing something with it. That, to me, is the most critical thing and the critical mark of a successful customer experience program or not. Joe, do you want to offer anything on that particular question?
Finding it hard to get to the single most important, because for the reasons that I said earlier around purpose and leadership, but let's come back to that. I would say in specific reference to digital transformation, I'm working on a big program right now in a local government context where obviously inclusion is important, you know, how we make sure that shift into digital is inclusive and accessible to all. But the wrapper around that is education. So how you educate customer and how you educate staff to actually embrace new technologies and provide them with the tools, the techniques and the skills to be able to use them effectively, I would say is underplayed in digital implementation. People get so hung up on the cool widget that's going to transform or make your business more efficient or effective, but they forget that actually the people who are using these tools are real human beings. So that would be my tuppence worth.
Thank you, Joe. Mikhail, any thoughts from your end?
I would just say one word that I believe for the last 2 years marked all our digital transformation initiatives is what you're creating needs to be flexible. Because what have happened in the healthcare industry for the last 2 years, that the changes of the situation, every 3 months, we were witnessing some new stuff, new elements that were impacting our business. And many times when you're building some solutions, some digital part, you're thinking, okay, this is the situation, we need to solve it. So we are designing something that will help the problems that we had 3 months ago. And it's extremely hard to think about what will happen in the next 3 months. But if you design digital transformation the way, we need to be ready if we want to reconfigure this to deal with the different objectives, and it's easy to be done, expanded, changed, then it's a higher chance for the success.
Thank you, Mikhail. Yeah, makes sense. Okay, the next question is from Shara. Shara, I don't know if you might perhaps want to come off mute. I don't know if you are unable to do that, and perhaps just clarify this question. I can read it out, but it might be better if you can clarify it yourself, if you're able to.
Yes, I may be able to try it. Thank you very much. Can you hear me?
Yes, that's great. Thanks.
Yeah, so apologies for the noise in the background. If it gets too noisy, I can always mute myself. The question I wanted to ask you, especially for any of the panelists, is how easy is it to create or put customer initiatives in GP practices, or in other words, practices that, or any healthcare setting that is actually not private? Because I know it's easy in private, but what about government, where our GP practices, for example, how easy is that to do so?
Okay, thanks for that clarity, Sharon. That's great. Joe, do you want to start on?
I'm guessing the reason Shara is asking the question is because perhaps she knows it's not easy.
Yes.
You can comment on that. It's funny, I was actually speaking to someone in a CCG context yesterday, and they were saying that despite the desire to want to do a good job and to potentially having the ability to innovate at a local level, one of the challenges at a CCG level is being able to come together on what good looks like and agreeing the guide rails for great patient or customer experience, and essentially getting people culturally to buy into that and to follow something that's for the greater good and bigger than that one individual practice, was what this CCG individual was saying was one of the hardest cultural barriers to overcome. So to answer your question, no, it's not easy, but it goes back to that wheel for me. You know, you've got to have a burning platform. You have to have a reason why you want to do this, and quite often the feedback that people are acting on is not substantiated, as in it's individual anecdotal comments that they hear from people in the community, or they hear from GPs or peers or colleagues. And that's why on our wheel, we have feedback as one of those critical success factors. The more that you can garner, the more that you can do a really good job of decent insight, both staff and customer, the more people are willing to listen and buy into the greater good of a customer experience strategy. I'm going to use that word. I think the feedback I gave yesterday when I was debating it with someone was that often we overlook staff. So we do voice of customer programs, but we don't run alongside that voice of employee and how they're feeling and how much under pressure they are. And often it's not just what you do, it's how you do it, and the how of asking staff and engaging with staff early on is really important.
Yeah, I like what you say there, Joe. I'd agree with that. The experience we've found is that a lot of healthcare providers are starting with caregiver experience and engagement programs first, rather than with the patient experience side, on the basis that, if you can make sure that you are understanding what the caregivers need, what support they need, what tools they need to be efficient and effective, then that can make a dramatic difference in terms of the patient experience. The other piece too we've seen is that actually the pain points on the patient journey, the cause of those pain points, whether it's in primary care, whether it's in acute care, or whatever, are also, more often than not, the causes are the same causes for similar pain points that the employees have as well. So you're really able to get quite quickly from taking account of either employee experience or patient experience, where some of those key pinch points in your processes are. So it's never easy, as Joe has said. What we are seeking to do from our end in terms of the software platforms relating to experience management, which is what Medallia provides, is we have quick start solutions and propositions which have effectively a templated approach, which makes it very out of the box. There is some capability and functionality that you can very quickly start to get value from in engaging with your patients on. And more importantly, we've actually just been announced on the NHS Shared Business Services Patient Communications Framework. So we also have very attractive commercial mechanisms now for procuring Medallia solutions. So I think that's something that we're going to get more and more experience of over the next 6 months, is at the GP practice end, deploying smaller implementations of our solutions and looking at the business change, the transformation that needs to happen within those smaller organizations, as opposed to many of the larger hospitals and care providers where we have already engaged in this way. So I hope that helps a little. All right, do get back in touch if there's any further clarity or insight you want around that, please. Next question I've got is next point from Bruce. Very interesting session. Can you indicate from your experience the success of patient, customer, citizen focus groups for gathering feedback and insights? Very interesting, actually, because quite often the whole customer experience space that we're talking about here goes hand in glove with research programs, with focus groups, etc. So again, Joe, is there anything you'd like to offer on this one in your experience?
Yeah, quickly, and let Michal, because I'm sure you've done a lot of the focus group stuff in your time as well. I think we're doing this right now with a client, and our view is that they're absolutely essential, but for validation reasons. So if you're looking to make sure that you're capturing what matters most across a large community, in this case that we're doing it with this week, you're talking 500,000 customers. So you can't run a couple of focus groups and be confident that you're going to get what matters most. But what we do find very, very useful is to use focus groups for validation of our hypotheses, so what we're learning through insight. Also, we do it for cultural reasons, because it's really important to engage from a face-to-face point of view, and we also use them for decision-making forums. So here's what everybody's saying. What do you think? And we find that culturally, that's a great way to bring in face-to-face engagement. That would be our approach to it. Michal, what's your experience of focus groups?
Thank you, Joe. I would largely agree with that. It's I prefer to collect insights through surveys, like one-to-one interaction with the customer, the patient, and I don't think focus groups are also a good tool to design some stuff. Some people are gathering few people, let's design the new process, and I wouldn't find it also very effective. But for validation purposes, when we design few processes, few versions, and then we show it to different group of customer patients and ask, like, how would you feel like being part of this process? And then they are giving us the comments. But to the final product, final process, then it's extremely powerful tool, because it really shows us what are the holes, which elements are not working, and where we should work more.
Okay, thank you, Michal. So we have a final question here. I'm conscious we're really up against the clock now, but let's take Alan's 2 questions here. The first is, number 1, how do we improve quality of data from the millions of signals to a level where we can improve consistency and trust the data in driving patient outcomes? So I guess, Michal, you've had some experience of doing this in your deployments at LuxMed. Do you want to provide any comment here?
Yeah, it's extremely interesting topic, and it's a very good question. First of all, what we notice, and this is many times the problem when we start running a customer experience program, when we're doing first survey and we have small sample of answers, and we're checking this periodically, then we see, okay, we see the NPS have dropped or it's increased, and we don't understand why. Mostly it's because the sample is too small, and we've noticed that it's more consistent and it's more reliable when we have huge sets of data. And so it's very much important to have larger sets than the small one, and be able to go through that in details, each survey, each by each. So this part is, I would add another element. Then it's good to have the tools like Medallia is providing, some kind of text analytics tools, because patient feedback is emotional, it's not very precise. Those are not financial data. Someone might give you some opinion that he's not lucky with the service, not because the service was not good, but because he's having a bad day, or because basically that's his psychological construction as a person. And by collecting large amount of data, you can basically find that those elements are not impacting the quality of data. And then with the tools like text analytics, basically, even if you are getting the answer for the question about the, I don't know, quality of the doctor, we sometimes collect the feedback. We're asking, are you happy with the consultation that you had with the doctor? And someone is answering, I'm very happy with the doctor, but I'm not happy with the digital tools. When you have text analytics tools, then basically you can say, okay, quality of doctor is okay, but someone mentioned that the digital is not okay. And this feedback is going to the category digital. So when you have that kind of tools, which in English is easy, in Polish, like when we get this from Medallia, it was extremely helpful, because it helped us solve a lot of problems, and most of the companies didn't have that kind of tools in Polish. So huge amounts with good tools to deal with the data can really guarantee that you'll have the good outcome out of it.
Thank you, Michal. I think the second question, Alan, that you raised, very interesting to me, actually, being Welsh and having been involved very recently in some of the NHS in Wales work around PROMs and PREMs, patient-reported experience measures, patient-reported outcome measures. I think my view is simple. There is absolutely a role for the likes of proms and prems there's lots of valuable data that they collect as a standard process, through the patient journey. They typically tend to be put patient outcomes, in my view, into more specific categories and boxes. Yep, because that's the way that they are designed to do. So you can code them appropriately and so forth. So absolutely a space and a role for that. Where Medallia plays, and with our customer experience platform, what we tend to surface is a lot more of unstructured data and unsolicited data. Say some of the unsaid, some of the unspoken stuff. So that sort of coexists and it complements more of the structured and even the clinical data that you're collecting as a course of your normal procedures. So that altogether, that provides, the very holistic view of the whole patient and gives you the opportunity to treat the whole patient when the patient reports, not just the symptoms that they're reporting with. So I don't know if that helps. I think there's a space for both of those aspects. And we would look to bring that together with our experience management platform. So conscious we were up on time now. We've overrun slightly. Apologies for that. In closing, I do hope you found this webinar insightful and thought-provoking. Should you wish to reach out to us to discuss further, or if you have any particular patient experience requirements, we will be delighted to hear from you. You can find me on LinkedIn. My email address is nigel.herbert@medallia.com. I look forward to hearing from you. All that remains for me to do is to thank you for taking the time to join us today. Thank you too to Joe and to Mikel for sacrificing your time to come on and join us. Thank you to Noreen and Leo and the rest of the team at Tech UK for coordinating this event. Enjoy the rest of the day. Thank you.